Good morning, Minister Butler and staff. I suppose the first point I want to make, as spokesperson for older people, and is a point that's made to me on a regular basis, is that disability doesn't disappear when you turn 66. Like one man, for example, told me his wife was disabled due to a stroke, so she was receiving supports and services in the community. When she was turned 66, she was told she had to move to a different service for older people, which didn't offer the same supports. And he was saying, like, you know, they did argue the point and got the supports maintained for her. But I mean, disabled people often say to me that suddenly it's like their disability has disappeared. And even when we talk about the cost of disability, I mean, the Indicon report was published a year ago, and it saw the cost of disability anywhere between 8,700, I think, and 12,500, depending on average, depending on the nature of the disability. Older people have said to me, why would they not, given the €500 this week, if they had a disability? Because they still have the additional costs, and they weren't. Now, they do recognise they are given double payments, etc., and they appreciate that, but they're still not given that recognition that there's a cost of disability, regardless of what age you are. Second thing, I know, and I welcome the increased spending on home care supports, but I suppose we have an older population, an ageing population, so we have increased need. And there are many, many people, as you alluded to, that have been approved home care hours and nobody is providing those. So that has led to delayed release from hospital. It has led to people having to consider going into a nursing home, and that is the last thing they want. So I think, you know, the sooner that the pay and conditions can be dealt with, we can have more people working in those. But you did mention that the most vulnerable are prioritised. Well, that's not my experience in all cases, because one man, the community nurse, told his wife that he and one other person in the community were the most vulnerable, the most needed, and yet his care providers are not available. Like, he's not prioritised for care. And this is the person who was then offered that home care cash grant that I brought up with you before. And he and his wife are not in a position to be able to negotiate that. It might be a grant that suits people where there's, you know, children that could look at and hire the person, but that's not available. Another thing that's brought up with me on a regular basis, and I raised with you before, was the boarding out option as well, because not everybody needs nursing home care and yet may not be able to live in their own home, but there's a boarding out option which is much more economically viable than nursing home care, and yet it hasn't been reviewed in years. I think it's 12, 13 years, and you know, so some boarding out places are closing because the money that they're receiving due to the cost of living and inflation and everything hasn't risen in tandem with it. My colleague here, Deputy Ellis, raised about dual diagnosis, and that was to do with addiction and mental health issues, but also there's to do with mental health issues and disability. And the mental health reform were in here a few weeks ago, and we were talking about how people constantly fall between two stools, because disability services say no, it's mental health should be dealing with you, and the mental health say no, it's disability services should be dealing with you. So people are falling between it. And I raised with you before, CAMS is an example of this, where they will not accept people with a diagnosis of autism to treat for mental health issues. Now, I make the point that a lot of people have mental health issues because they're not getting the supports they require when they have a diagnosis of autism. But regardless of why, there needs to be a cross-departmental working together of the different groups to address the issues. And the one other issue as well, like the UNCRPD is all about independent living and supporting people to live independently. I have an example of a 21-year-old man in my constituency who has muscular dystrophy. His mother was his main carer, but due to an accident she's not able to help him now get in and out of bed. The home care support comes in sometimes as late as 11:15 in the morning, so he's not up till 12:30. But what's worse than that, they come back at 6:30 or have him in bed at 6:30 that evening. That's not a life. That's not independent living. This is a young man of 21. I mean, some days he's only up for 6.5 hours. and I know other people have complained as well about the timing, of care, and I know it's down to the constraints on the number of carers that are there, but it's something that needs to be looked at. That's what the person's needs have to be taken into account as well, and especially when they're a younger person. But it applies to many across the spectrum that they have to get up at a certain time and have to go to bed at a certain time to suit the carers rather than the carers suiting them. Thank you, Minister.
Mm-hmm.
Thank you, Deputy, and thank you for your continued interest. And look, at the outset, I just want to say you did raise the issue in the Dáil previously about PARs, personalised hours for home care, and I thought, I didn't realise actually that they were available. They're only available, would you believe, I checked it out afterwards, and I just want to apologise for that, because they're available only in CHO 1. It's not available across all the others. They used to be previously, and they're an area that I do think that they should be available in the tender going forward. I have put that on the record, that I do believe for some people they work. They don't work for everyone. But the day you raised it, I thought you were actually speaking about disability hours, and I just want to clarify that you were completely right, and they are available in your area. They're not available in the other 8 CHOs, and I suppose it probably deals with people that are probably finding it very difficult at the weekend to get support, and they move to providing the budget for them. So I just wanted to say, in fairness to you, I just wanted to clarify that. In relation to, you were saying that disability doesn't disappear at 65, and it certainly does not. But there is no cut-off at 65 for people with disabilities. There are people over 65 in receipt of day services and home support through disability services. But I think I understand the point you're making, and they are based on individual need. What we're developing at the moment is the INTRA-I, the standardised assessment to ensure transparency in decision making. So we want to move to a situation where we have, we want to move to a situation where people can be cared for completely at home. And we want to put in place a scheme where people don't have to go into a nursing home, even though they might require nursing home care. And in order to do this, we have to roll out the INTRA-I standardised assessment. So currently we have 4 pilot sites in operation throughout the country in relation to that, and we're currently recruiting the 128 INTRA-I assessors. That recruitment is starting. I'll leave Siobhán come in on that.
Yeah, so the INTRA-I assessment will address some of the issues that you've spoken to there, which is, a lack of, at times, transparency perhaps in how home support may be prioritised. So I think for service users and for staff, it's really important that we're all working to the same level playing field and that we understand the decision making. But that will definitely complement the work that's ongoing in terms of increasing the workforce. So INTRA-I is a tool that is being rolled out across our CHOs in many of our hospital settings and in pilot sites to do with home support. And it's a care assessment, so it's all of the people who work with an individual, the nursing staff, the physiotherapists, the occupational therapists, and our integrated care programme for older people, our specialist team for older people are adopting that standardised assessment. So across the country we will be able to have that assurance that as people are identified as having care needs, that their allocation is based on that assessed need. And that's going to be really important around ensuring that we're making sure that the right people are getting, the care they need. Your point around the timing, absolutely, I completely agree around. It is important that when people are identified as having particular care needs, that it matches their lives and isn't based on what the system can tell them they can have. It has to be more about putting the person at the centre rather than the workforce issue at the centre. So we do need to get to that space. We totally accept that. Thank you.
Yeah, and I agree, Deputy. You don't want a situation where somebody might be only up for 6 hours a day. But there are challenges we have again, because a lot of people who deliver home care are working split shifts and they want to go home as well in the evening time. And, I often hear this from families that they don't want their mother or their dad being put to bed at 6 o'clock in the evening. But in fairness to the home care worker who has already probably worked in the morning and the evening. So it's all of these, work-life balances that we are looking at as well. I do believe the ICPOP teams, the integrated care programmes for older people, have made a huge impact. So we've 22 of them up and running now, and we have to get to 30. And they're just the most fantastic. It's like a one-stop shop for people, for older people. So when you present to the IGPOP team, they will look at everything. They will look at your frailty. They will look to see, are you at risk of falls? They will look to see, are you at risk of stroke? And one of the things I did this year, which I was delighted to provide the funding for, psychiatry of later life, isn't included in the IGPOP teams, and I secured the funding to put 3 pilots in place, because I do believe if you're an older person, being able to go to present to one particular facility and have all your care needs met and analysed, as against having to go across the road to the psychiatric, a piece of what you need. I think it will really help to take the stigma out of psychiatry of later life, having it all included in that particular team. I'm going to ask Philip to come in on the autism piece.
Yeah, absolutely. Thanks so much, Deputy, for the question. So just briefly to, first of all, deal with the issue of the mental health of intellectual disability or dual diagnosis in this regard. So it's a particular focus of Sharing the Vision again. There have been 2 recently published models of care for adults with intellectual disability and mental health issues, and also for children. So the CAMS ID model of care and the adult MHID model of care. Since 2015, approximately 150 staff have been recruited into supporting the provision of this service across the country. Obviously, it has been difficult to recruit in the CAMS ID area in particular, and it's a particular focus of recruitment endeavour, specifically in the area of training more psychiatrists to take on the role of consultant child and adolescent psychiatrist with a special interest in intellectual disability. With regard to the access for people with autism and mental health difficulties, the published CAMS clinical operating guideline from the HSE that was published in 2018, it clearly sets out the appropriate pathway for people with autism. So if a child with autism is presenting with significant mental health problems of a moderate severe level, well then it's absolutely appropriate that they would be referred and seen by CAMS teams. It can get difficult clinically sometimes to decipher if the behavioural presentation of the individual is primarily a mental health issue or related to difficulties that the child has with autism and various environmental triggers, environmental difficulties. And best practice would suggest a good engagement between the CAMS ID team, the CAMS team and the network area disability team to really work out the primary needs of the child, and then to work out what services is best, is most appropriate. There's a particular recommendation in Sharing the Vision that really looks to that as an area of service improvement, and that's an example of an integrated care challenge across children's services that the HSE is currently looking at.
And if I could just touch on the boarding out, because it is unique to specific areas in the country as well, and we will certainly take a look at that, because you were saying that the fees haven't increased since 2009, was it?
I think it was 12, 13 years anyway, yeah.
Yeah. It's like that we have community care homes in the southeast of the country, so we'd have them in Waterford, Wexford and Carlow. I visited one of them with Deputy Maureen O'Connor previously, a couple of them in Carlow, and what they are they're community care homes. So they're low-level supports for people who, it's a step, I suppose, between a nursing home and leaving your own home, but you do have care provided by, there would always be a nurse on duty, and it's a fantastic model, because it means it's home from home, you're living in your own community, you're not on fair deal, you pay a percentage of your pension, but it also means that there's local people working there, so people that you might have known all your life in the community are working there. We have 10 of these homes in the southeast. They're an absolutely fantastic model. It's like the boarding out model, but we will certainly take a look at it to see is there anything we can do in relation to the cost there. And I'm not even sure how many people take part in the boarding out model. As I said, it's unique to specific areas in the country, but it does, I believe, work very well for some people.
I mean, there was 2 issues with it. The HSE pay a certain amount, but each CHO area paid different amounts. So when you have a boarding out facility on the border of 2 CHO areas, which you might do where I am in Cavan, say Longford, the HC were paying different amounts and the individuals were paying different amounts, and as the person said to me, there'd be war if they found out that they were being charged different amounts. But it's even just to look at it to deal with that issue, the standardisation issue, but also to increase the amount that's being paid as well would be welcome. I welcome everything you said there, and like what you're talking about there, the ICTOP, is it the
ICPOP teams?
I mean, they sound brilliant, but I'm just wondering, is it like there's Children's Disability Network teams, which again on paper is a brilliant model of care, but it's just the recruitment of staff into these teams to make sure the team is complete. And
these teams are actually working really well. They're multidisciplinary teams, and actually I recently visited the community, the CNU, the community nursing unit in Ennis in County Clare, and a fantastic facility. But where I was really struck was the ICPOP team, the Integrated Care Programme for Older People, was actually located within that hospital.
Okay.
You know, so they really are the way forward. And as I said, we've 22 teams in place. We're going to get to 30, and so you have geriatricians working here, you have dietitians working here, you have physiotherapists across the board, you have clinical nurse specialists, and as I suppose what the whole purpose of it is to mean that people won't have to present to the A&E, that you kind of preempt maybe the fall they might have, or you know, you might have people who suffering from, through no fault of their own, that they mightn't be having a sufficient nutritious diet, for example. You know, and all of these, as I said, it's like a one-stop shop. You go in and the whole raft of tests are done, and the best plan is put in place for that person, working with their GP, their public health nurse, and that team.
And is it a referral from a GP?
A referral from a GP.
Okay.
Yeah. Have you anything to add on that?
There'd be further information on the HSE website. So for each particular CHO, there's information on those services. So maybe for the public or for yourselves. And if there are any particular questions from your area, we'd certainly be happy to redirect them to your CHO. But there's lots of information on the pathways, and they are in development. And I think what we would hope to see is getting feedback from families and from service users about how well they've worked, or if there's areas we need to invest more in. And certainly the strong links over with home support and actually with our community and voluntary sector. So we know those teams work, say, with the Meals on Wheels or with other parts of the community to ensure that the community around the individual is supporting that individual to live well at home. Thanks.
Thank you. Thanks, Minister.
Jennifer.